Hi, good morning, Mr. Mendez.
Good morning. May I know who I'm speaking with?
This is Prajem from Dr. Shapiro's office. How are you feeling today, Mr. Mendez?
Oh, good morning, Prajan. I'm doing all right. Thank you. How about you? How are you doing?
I'm glad to hear that you're doing all right. I'm doing well too. Thank you for asking. I saw that you're due for an annual wellness visit on Wednesday at 10 a.m. with Dr. Shapiro. Are you available for the annual wellness visit?
Yes, I intend on making it there for the annual wellness visit.
That's great. I see you haven't completed the health risk assessment. If you had just a couple of minutes, we could go ahead and complete your HRA. It'll only take a couple of minutes. Shall we get that out of the way then?
Yes, I'm ready. Sounds like a good plan.
Wonderful, Mr. Mendez. Now, I'm going to ask you a series of questions based on the data we have of your conditions and a few general health related questions for the HRA. Is that all right with you?
Yeah, that sounds fine.
Okay, so you could answer with excellent, good, fair, or poor based on what you really feel.
Oh, all right.
In general, how would you rate your overall health and quality of life?
Overall health and quality of life, I'd say good. Really can't complain too much. I still seem to be able to get around all right.
That's great. In general, how would you rate your mental health?
Welfare, I'd say.
Mm-hmm. That's all right. So, in the past 7 days, how much did your pain interfere with your day to day activities?
Oh, I'm not in any pain now. The new medications I've been on seem to be working well.
That's really great to hear. Now, regarding physical activity, do you engage in regular exercise or any kind of physical activities?
Yes, I try to go for walks a few times a week. It helps me stay active and clears my mind.
That's wonderful, Mr. Mendez. It's essential to find activities that bring you joy and keep you moving. Now, about your diet, how well do you maintain a balanced diet and a healthy eating plan?
I do my best to eat nutritious foods, but I also enjoy indulging in some of my favorite treats occasionally. Although I'd say I do good with maintaining my diet.
That's awesome, Mr. Mendez. It's all about finding a balance that works for you. Lastly, do you have any specific health concerns or conditions that you'd like to discuss during your AWV?
Not at the moment, but I appreciate you asking. I'll make sure to bring up any concerns with Dr. Shapiro during the visit.
That's understandable, Mr. Mendez. Over the last 2 weeks, how often have you been bothered by feeling down or hopeless or finding little interest and little pleasure in doing things?
Yes, well, I wouldn't say I have felt really any sort of a downer of late. Things have been going well for me.
I'm so glad they are. That's really good. Have you experienced any significant stressors or life changes recently?
Nope,
Do you feel anxious?
nope,
Do you feel depressed a little?
not at all.
Great. Okay, so because of a health or a physical problem, do you have any difficulty doing the following activities without special equipment or help from another person? Bathing or grooming
Oh,
or.
yo, no, no. Absolutely not. I am still very much able to take care of myself without assistance.
That's really good, Mr. Mendez. Just a few more questions and I can let you go, alright? Do you think you have a hearing problem or do others think you have a hearing problem? Or are you wearing a hearing aid?
Yes, I do wear a hearing aid, but only because I had an injury around a decade ago. But I'm all well and hear quite well with it, since I don't leave home without it ever.
Yeah, I hear you. Do you have any difficulty driving or watching TV, reading, or doing any of your daily activities?
No, not as of late. Like I said, I'm feeling good.
Do you still live independently or have you shifted to a senior home?
Yes, I still do. On my own.
All right. And when was your last comprehensive physical examination? Are you up to date with all the vaccinations and flu shots?
Yes, I'm all up to date on the shots. I did get an examination done a few months ago. All looked well then.
That is awesome. Looks like we're all done here with the HRA. Thank you for your cooperation, Mr. Mendez.
Most welcome, Prajaim. Thank you.
So, just to confirm, your AWV is on Wednesday at 10 a.m. Your HRA has been completed. You'll get another email and a text with all the relevant information you'd need. Is there anything else I can help you with?
No, I think that's all for now. Thank you for your support, Prajaim.
You're very, very welcome, Mr. Mendez. If you ever need anything or just want to chat, don't hesitate to reach out to us. You take care of yourself, yeah?
Thank you, Prajan. Take care as well. Goodbye.
Goodbye, Mr. Mendez.